This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches. Welcome to Healthcare Snitches.
Welcome to episode whatever number we on.
After you get to a certain point, you stop counting.
Yeah, who knows? But before I forget, because apparently this episode needs to be on dementia and Alzheimer's.
Both of us.
Please make sure you like and subscribe to our YouTube channel, Healthcare Snitches, and turn on your notifications so you get the alerts when we post new episodes every other Sunday. Also subscribe to us on Apple Podcasts and Spotify Podcasts.
Yeah, and tell everybody that you know.
Tell your mama, tell your uncles.
Tell your mama's husband, your mama's boyfriend, all of that.
Your mama's chiropractor.
Not mama with the bad back.
Right. You know. And also follow us on social media, Instagram, Facebook. Where else are
TikTok.
we? TikTok. And you don't stop. And,
go ahead, DJ.
Right.
Jazz.
Oh, gosh. I've been DJing these last few episodes. Where else are we? Facebook. Did I say that already? I'll say LinkedIn. We're not on LinkedIn.
We're not on LinkedIn. We should be, but we're
right.
not. So do that. Today's topic is breast implant illness.
Ooh.
I'm not sure if you guys have ever heard of that. You know, a lot of women get breast implants, but you know what I've been actually running into during my research, because I'm about to cut these off and get some implants myself.
I might be right behind her. I ain't cutting them off, but I might be getting the plants as well.
You said the plants.
Yeah.
A lot of women are coming back to get them removed because of this here breast implant illness.
Yeah.
A lot of them are like, give me back my flat chest where I was healthy, I was happy, I was not miserable, and take these things off. And a lot of women are feeling like once they are removed, they feel better just like that.
Wow. Yeah, I did see some people, even people posting on like TikTok who had symptoms of breast implant illness, say that they would go back to their surgeon and be like, or to their doctor, to the PCP, and complain of some of these symptoms. And their doctor would be like, oh, you know, that's unfounded. Implants don't cause this. And they're like, but I didn't start having any of these symptoms until I got the implants. And so it has to be the implants. And then they get them removed and all the symptoms go away. So you tell me what it is.
Carry the one. But
it's not everyone that gets symptoms of this.
Some people are fine. Some people have their breast implants in for years and never have any issues whatsoever.
Yeah.
Ever. So
are you supposed to get them like swapped out every couple of years or something?
They have different life expectancies on them. Some are 10 years, some are 15 years. There are people out here who have had them for 20 years. Theirs need to be replaced. But yeah, you are supposed to replace them. And then you talk to some surgeons and they'll tell you, oh, you're 40 something, you're 50. You'll never have to get these taken out.
Oh, okay. I mean, are they made in China? Like, are those the people who be having the issues?
I don't know where they're made.
Do they have organic ones that I can look into perhaps? I'm just saying, I may need them. And I want to know all my options. Okay?
I can't. I really cannot with you.
I need the non-GMO implant.
Okay, well, we are going to learn today what type of different implants you can choose from.
Oh, okay.
Okay.
Because you won't educate me.
So, BII is what we like to call it, right? BII. So that's 3 syllables. Breast implant illness is 5 syllables. So it's easier to say BII.
Okay. I never seen anybody count down like that. Like they're throwing up gang signs, but I digress. Crip fucking. Right. We are not gang affiliated. I just want to point that out. I can't.
Okay, so it's a condition that is not well understood, right? Hence the doctor saying what they're saying. But it can be pretty debilitating, right? So the symptoms vary from person to person. What Shakisha over there has, Emily over here may not have those same symptoms, right? So it's different for everybody. And it can include fatigue. It can include joint pain, like joints anywhere. Like you can feel like you have lupus when you wake up in the morning. Yes, that's what it sounds like. You can have memory and concentration problems, which we already have without the breast implants,
right?
And a lot more other things. Because just like, let's just take a second and just think. This is a foreign object going into your body, right? So your body could be trying to fight off this foreign object and cause like some type of autoimmune diseases and stuff where the body's like attacking itself. It's just crazy.
Sounds like something we shouldn't do because if there's anything to be gotten, we're going to get it. Right. Next thing you know, we got MS.
If there's a symptom,
I don't know if that's one of the things, but
if there is a symptom to be had, Jasmine and I are going to experience.
They'd be like only 0.1% of the population left eye falls out,
and we would have one eye.
Yeah, we would.
Yeah. No, you are absolutely right. If there's any side effects to be had,
we having them.
We gonna have them. We have them without even knowing that they were side effects.
Yeah.
Okay. So, believe it or not, BII is not an official diagnosis as of yet. And that's why that doctor is saying what he's saying. So I did my research, right? I was actually scheduled to get some implants. But when I called and I spoke to the coordinator, she was so nice. We spoke for like 45 minutes. You know, I can hold a conversation with a stranger. And I was like, one of my last questions was, breast implant illness. What can you tell me about it? She was like, listen, it's not an official diagnosis. This is what she said to me.
Why? Because it's not in the ICD-10
exactly.
diagnosis. Okay, they can add it.
It's on the road there, though.
Okay.
She said some women feel like they experience X, Y, and Z. She said it's not evidence-based. It hasn't been proven. I said it hasn't been proven in a textbook, but a lot of women out here that I follow on social media, like there are groups who are out here talking about this. That was my deciding factor. And also I have a lot of breast issues. I don't need implants being on top of those issues.
Causing something else.
Making it harder to see these issues.
Oh, yeah.
Right? Because I have dense breast. So it's hard enough to see the issues right now because it's very glandular. That's what dense breast mean, people. Very glandular, right? So, just imagine putting an implant on top of that. So I would rather wipe these things out, take them, or as my Aunt Lisa would say, take these boobs and put them, you keep them, right? And then put in implants because then it's less breast tissue to be involved.
But that sounds like it's only going to make the implant juice closer to you to seep in to cause this little illness.
But that's if they leak. Hopefully they won't leak.
Well, what are they leaking? Is this what's causing this? I think that's why they can't narrow this down.
So the saline implants is what would be able to leak because it's filled with saline. And for those are the safest types of implants to have because if the saline leaks, your body will just absorb saline, right? But if there's a problem with these other implants, there's chemicals.
So a lot of people that report these illnesses do.
It's all types. All types.
And they got the organic non-GMO ones or nah? Or they getting a Ziploc bag full of.
I can't.
Okay.
And then also, even though saline may be the safest, it's not the nicest aesthetically, right? Because because once they start to get old and stuff, you'll see like wrinkles. Like you ever saw?
I mean, like regular boobs.
Old women with implants gets like Or one can leak and the other is just chilling, and you.
Oh yeah, I've seen that on a movie.
But lots of times with the wear and tear of it's not nice. It's not nice.
I see.
But a lot of women go that route because it's the safest in their head. So it's not an official diagnosis. It's not completely well understood. Some experts believe that it may be caused by an autoimmune or an inflammatory reaction to the implants, which I just said, right? So your body it's something foreign to the body, and the body starts trying to fight it off to get it out, and it ends up attacking itself. That's what autoimmune is, right? The body attacking itself. So then you get these autoimmune diseases. So when Jasmine earlier said, sound like rheumatoid arthritis, honey, that's an autoimmune disease. So you weren't far off. It could be with the joint pain and all that stuff.
You gonna stop throwing them gang signs during this episode?
Okay, so it can affect people with any type of implant. So here's the different types of implants. Jasmine, take notes because I know you out here searching. All right. Okay, so they have the silicone gel filled. They have saline filled. Smooth surface. Ooh, smooth surface, girl. Textured surface. I don't know what that is. Round or teardrop shaped. I don't like the teardrop shape. A lot of porn stars have those.
Oh, okay. So how you know? You be watching porn?
Girl, I used to watch it when I was young.
Okay.
And it can happen whether the implant has ruptured or has stayed intact, as far as BII goes. So you don't have to have a rupture to have these issues. It can be whole. And you know what? It can happen 3 weeks after you put it in. It can happen 2 weeks after they're in. Or it can happen 6 years after they're in. It can happen at any point in time.
So let me ask you this, right? So understand that these implants are filled with different things. What is it encapsulated with? I feel like that is the key to figuring this whole thing out. Like, what is, because that's what's in contact with your actual, like, body, right? So not, because it can happen with or without the puncture. So to me, it's what is surrounding either the silicone or the saline or the texture stuff.
What is surrounding? So the smooth surface, so it can be silicone inside, or it can be saline inside, right?
What's on the outside?
What's on the outside is smooth, or you get textured.
What is it made out of?
Girl.
And who's out here getting textured boobs?
A Ziploc bag. I don't know.
That's what I'm saying. Is it saran wrap? Because, like, how is it now seeping into my bloodstream to give me an autoimmune response?
But maybe, I don't think it's into the bloodstream. What I think it is it's a foreign object. Okay. And the body start fighting.
But how does it know
that it's a foreign object?
Yes.
Because the body been with you since birth. That thing wasn't there.
Okay. Who did the body? The surgeon. It said who all over there. So similar to when we were pregnant and the body was like,
and our bodies were, yes.
It was like, no, we don't want this.
Yes, because listen, I knew after Corey, I would never house another life in this here uterus.
Our bodies were like, what is going on?
Yeah.
We don't like this. We're not doing this. Yeah. We don't want it.
Girl, that's a perfect example. Yeah. Yeah. Okay, so signs and symptoms in more detail, more depth. Joint and muscle pain. There you are with the RA. Chronic fatigue. Memory and concentration problems. Breathing problems. Some women have breathing problems. Sleep disturbances. Okay. Rashes and skin problems. So, like, you can get acne and all this stuff. Dry mouth and dry eyes.
What?
I will tell you, I have read somewhere also that a couple of women have had dry cooch.
Are these women also going through, like, menopause? Like, because these also sound like...
Some of them are young women in their 20s. Anxiety, depression. What I think that the depression is really linked to as well is that issues? They don't feel good. These women don't feel good. Their quality of life is just out the window. I've read that some women can't even get up and go to work because of the ailments that they're dealing with.
They're gonna get over that.
Headaches was huge. Hair loss was huge as well.
These all sound, quite honestly, and this is why it's so important to like be in tune with your body and like go to the doctor, because quite honestly, all of these symptoms sound like something else, like perimenopause, menopause, PCOS. They can overlap.
Gastrointestinal problems, just
IBS.
overall, your body is not right.
Dang. So do these people most of the time feel these all at once? Like, how do they know?
There's some women who have suffered for years before they carried the one and put two and two together.
Okay, and then they obviously.
But now that it's like such a huge awareness about it, I would freak out. I'd be like, "Oh Lord, I got a headache. I got BII."
Not a brain tumor?
Not a brain tumor.
Because for you, I feel like
it would be everything that I go through would be BII. Everything. Do you hear me? It would be, everything would be linked to that.
Well, please don't get any, because that's stressful just hearing that.
So it says the symptoms can appear anytime, which I said before. Some people develop them immediately. Some people develop them years later, right? So you can get these implants and be just fine. You be out here in your bathing suits and your two-piece and showing cleavage and all that stuff. Girl, you could take off your bra and those tits are at ease, okay, honey?
At ease or at attention?
At attention while they're at ease.
Oh, okay.
And everything's fine. And then one day, you wake up with rheumatoid arthritis.
I can't. You wake up dead one day. You ever heard somebody say that? I can't.
No, I've heard people say, well, this is the first time he died.
He gonna die multiple times? I can't.
This is the first time he died. He ain't never died before. Okay. I'm just saying. And a lot of these symptoms are affiliated with autoimmune and connective tissue disorders, such as lupus.
Ooh.
Lupus is a connective tissue disorder. So is rheumatoid arthritis. And scleroderma.
Okay.
And not everyone gets diagnosed. Not everyone who gets diagnosed with these 3 autoimmune issues have BII if they have breast implants, but my eyebrow would go up.
Yeah.
I would be linking the two. I'm sorry.
I need somebody to do a case study on this immediately, preferably before I decide to get some.
I'm sure lots of case studies are out there now that it's like such a big thing. So it says, in many, but not all cases, surgery to remove the breast implants improves or completely resolves BII. Oh, and just to let you guys know, all this information that I'm getting today comes from breastcancer.org. So it's very reputable. Don't play with me. Play with somebody else. Okay?
Yeah.
Believe what I'm telling you. So they said removal of the breast can either cure it or get rid of some of the symptoms. But guess what? There's some women out there who remove it and they're screwed. The damage is already done.
Oh, that's horrible.
Isn't it?
Yeah, because we got to think about it, right? So not everyone gets implants because they just want to get implants. A lot of people have like double mastectomies, and so they're getting implants now because they want to have breasts.
Reconstructive
right.
surgery.
And so now you've gone through all of that only to have another set of issues that you could potentially reverse or not, or I don't even know. I mean, if you could get the non-GMO organic ones, then maybe that will lead to these issues. Who knows? Okay.
I don't know. But no, that's absolutely right. Lots of women have mastectomies, get reconstructive surgery, have to get these expanders put in, have to have those in for a minute sometimes, and then you have to go back and get the breast implants, and you're already thanking God that you made it this far, that you beat the cancer, that you finished your chemo and your radiation, and now you're ready for the next phase of your life, and you want to feel confident. Your hair probably fell out from the chemo medication. It's a lot.
Yeah.
And guess what? Now you have these symptoms and you're feeling like death all over again. That's awful.
Yeah, I can't even imagine. It's giving, like, you know, K. Michelle. That was K. Michelle, right?
That
where she had to get
injection?
all, and she was like trying to get all like the stuff that was injected removed. It's giving that. Like, I get that's a different thing. What did she have injected?
silicone, I think.
Oh, okay.
And it hardened, or it was supposed to be silicone. It was something else, and it hardened, and she had to have multiple surgeries to get it removed. Yeah. You want him to make his debut?
I feel like we've shown him before, but
No,
if not,
he's
then
on
we
bar.
could just show him because
Look, this is Peanut.
Seems to be missing me.
He's Dutch.
Yeah. He keeps
Hi,
coming
Peanut.
up to me during this episode, so.
Hello, Peanut. All right, yeah. You made your debut.
Okay, bye. Don't come back over here either.
He's back.
Okay.
He said, I like the TV now.
Right.
Okay. So there are currently no diagnostic tests or diagnostic criteria specifically for BII. So let's just keep it in mind. There's no diagnosis for it, right? It's just the word on the street, right?
Yeah, it's also, I know I keep interrupting. I'm so sorry.
No. We're having a conversation. This is good.
It's also like people who have had a copper IUD. So they swear that there's all these Facebook groups about it. It's supposed to be a safer alternative to the hormonal IUD, but people swear that the copper causes like all these other issues. And I can personally say, as someone that had it, I believe it caused a lot of issues for me. So that's why I got it taken out. Have my issues resolved from getting it taken out. Some of them have not. I'm still working through some.
What's some of the issues? We are just gonna digress for 1 second.
Yeah.
What's some of the issues that you had?
Well, heavy cycles was one. So that kind of that actually didn't really dissipate until more recently. Tiredness. I had joint pain. I had a lot of joint pain. I don't have that anymore. Just overall like tiredness, fatigue, around my cycle.
But that could be anybody.
It could be, but I know because it wasn't like that before. And once I got it taken out, that got better. Like the joint pain got better. The extreme tiredness got better. They say like it can cause some people to have like insomnia, and the acne was also a thing, which I'm still working through. But mine was definitely caused by my initial IUD, which I got removed because it made my face break out so badly. But
so that's a perfect example of removing a foreign object from your body,
because it's a foreign object
and the damage already being done.
Yeah, it's actually, it may just be like you said, it's a foreign object, nothing more, nothing less. Just that your body just is like, I don't want this in me.
And it's not a temporary foreign object, right? Because you wear a tampon, that's a temporary foreign object, right? Yeah. You have intercourse, that's a temporary foreign object. Right, these things come back out. You get intubated for surgery, that comes out, right? So these are things that stay in, and the body is just like, who did the body?
It's like, it was cool that you were here, but like, why are you still here? Yeah. Does this happen to people that have like pacemakers and stuff?
I haven't researched pacemakers. Maybe we can make that an episode.
Yeah, because I mean, some people just need to have a foreign object to live, like a pacemaker. Like you can't get rid of that. But like, any of these like implants, I don't really hear the same about like dental implants
or penile implants.
I'm done. Not with that being.
But normally the dental implant is replacing something that was there.
Yeah, but it's not the original something that was there, because I mean the breast implants are too, but not directly breast tissue.
Well, for me, it wouldn't be replacing something was there because I ain't never had it.
You got it.
I ain't never had it.
I'm not doing this with you.
Okay. So there's currently no test. So like you can't go to the doctor and get a CAT scan or get a blood test or give urine and hope that you get back a diagnosis of BII.
Well, they can't diagnose you because they don't even recognize it.
Yeah. It's not going to happen.
They're going to diagnose you with one of these other things.
So what they're saying here is plastic surgeons may need to order tests and review medical records to rule out other diseases or conditions. So it sounds like it's a very lengthy. I gotta switch the G. Lengthy.
Yeah.
Okay, thank you. Lengthy. Hey, listen.
I mean, I'm here.
Listen.
I understand what you're saying. I wasn't gonna correct you.
No, I'm asking for help.
Mm-hmm. That's fine.
I had the G on the other
Mm-hmm.
side. I had to bring the G back to the left. Lengthy process. It's gonna take a while. But if I were you, and if you have breast implants, and if you recognize any of these signs, start preaching to the choir ASAP. Don't wait.
It sounds like the only remedy, though, for this is to remove them.
Yeah.
Sooner rather than later.
So it says doctors may check you for arthritis, right? That's all that joint pain that you're feeling. Lyme disease. Thyroid problems. And see if symptoms improve with treatment for those conditions. So I wonder if people are actually getting false positives for these conditions, right? Based on their symptoms and based on a doctor, just because doctors are quick to say, oh, you have arthritis.
Yeah, because I mean, if you think about it, if you go to a plastic surgeon, especially the one that did your implants, and you're like, and more people are going, and they're like, these implants are causing these issues, then they're losing out on future business. So they don't want to, it's in their best interest not to diagnose this.
I mean, yeah. But Lyme disease, they would have to do a Lyme panel, and either you got Lyme or you don't.
That's a lot.
And then removing the implants and all or part of the surrounding scar tissue capsules. So you got to take out the implants and then the scar tissue capsules that have formed is the most effective treatment for improving the symptoms in the long term.
Capsules are forming?
Yeah.
Oh.
So plastic surgeons usually don't recommend removing them and then replacing those breast implants because it's not necessarily the actual implant that caused the problem. It's the fact that you had implants at all. So if you had BII once, there's a strong possibility that you're going to get it again. So don't think that you could be like, oh, I've had these for 4 years. Now I'm getting sick. Let me take them out and put something in. That would be foolish. Just get a lift and just let them lift whatever you had before you started.
What if you don't have anything to lift?
Then just chill. Well, you should have something to lift because your breast will probably be stretched out from the implant a little bit. So they could probably snatch it and lift it, smack it up, flip it, and rub it down.
Fluff it up like.
Yeah. I mean, you're going to need reconstructive surgery. So.
I'm sorry, he just slipped.
Who, Peanut?
Yes.
I missed it. He fell off the step?
He didn't fall. He just, slipped real quick. That was funny.
I totally missed that.
So when people get the implants removed, do they have to do, a detox? Or should they do, a detox for all the...
I don't know. I guess if you're a strong believer in herbs and detoxing and all that stuff, it can't hurt. But the average person probably would, and they probably just say, "Get these things out of me."
Yeah.
I'm assuming that has to be something that you're into.
Yeah.
So that you can,
get out of your system.
Mm-hmm. Yeah. Oop. Is Peanut about to take a drink?
I don't know what's happening right now.
So anything else that you have for breast implant
Me?
illness?
I was the guest on this episode because
Well, after hearing all these things, right? I personally don't think that you would need breast implants. From what you tell me, it sounds like you may qualify for a lift later down the line.
Yeah. It's just not giving what it gave.
I know someone who had breast cancer and she beat it and she got a bilateral mastectomy. She didn't want implants. She didn't want a flap. She didn't want any of that. So she has nothing, but what she did is she got one of those prosthetic bras.
Oh, okay.
That the insurance normally covers for mastectomy patients. Mm-hmm. And she said the boobs are in the bra. And she has 3 or 4
she
of them.
Takes them off and hangs it up?
She takes them off and hangs it up. And it comes with white boobs. It comes with black boobs.
It comes in a variety of colors. Is it light skin black boobs or they got chocolate
They
boobs?
have different shades of it.
Oh, look at that.
Mm-hmm. And she said that she just did not want to deal with that. She just made her 10-year remission mark. and she said that she just didn't want to deal with implants.
I get it.
And that was what her personal choice was. And
Yeah.
she's married and all that stuff, and she wears bathing suits. She did say that it's hard for her to find bathing suits because like she has to have on a bra with it.
Yeah, with the prosthetic. Oh wow.
Yeah. So, I mean, these are things to consider if you're considering implants. Just do your research, find a good surgeon, find someone where if you ask them about breast implant illness during your consultation, that they won't just brush you off and make you sound crazy. Hopefully they will address it and tell you true. It's not evidence-based yet, but yeah, there are some people who do get some of these issues going on, right?
Yeah. I mean, bottom line, if your doctor ever brushes you off, just switch doctors.
That's her motto. She don't be playing.
Because at the end of the day,
the day gonna end.
The day gonna end. And it ain't gonna end with me having BII. Okay?
Yeah. All right. Well, I guess that's it. We can wrap this up.
All right. Bye, guys.
Thank you for tuning in. Tune in next time.